Good afternoon, ladies and gentlemen. Welcome to this new segment of MedCast. MedCast is a program that is designed to show you the latest update in the medical field. Whether you are a curious viewer or professional healthcare, you can follow us to know the latest update in the medical field and also to know the latest innovation regarding the medical field. Today, we are pleased to have again Dr. محمد Jawad, who is specialized in endocrinology and diabetes. Welcome, Dr. محمد.
Thanks a lot. Thank you.
Thank you for having you again here.
Thank you. Thank you very much.
Dr. Muhammad, regarding your specialty, we have a very big issue we have in the society nowadays. You know, let's say the youth people who are going to the gyms and going
Yes.
to having some exercises, they immediately try to go in the direction of using the performance enhancement medication, which are mainly our hormones, which is a very big part of your specialty.
Yes.
Now, let's talk about these medication. Are they safe to be used again without medical supervision?
Sure. Thanks again for having me, first of all, and I appreciate the chance. With regard to general population or young population, usually going to the gym, and which is a very healthy behavior, I believe, and I encourage them to continue on going to the gym, at least exercise.
For
But
exercising only.
yeah. So the question is whether these young men, young athletes are using performance enhancement medications, usually hormones, usually testosterone, and to lesser extent growth hormone.
Mm.
First of all, taking this without supervision is quite dangerous. I know that this is quite widespread in the population, and there are many people who are using, unfortunately, without supervision. But I do respect the experience of
The trainers.
exactly.
Yeah.
Some trainers are quite experienced.
Mm.
Now, if we want to talk medically, these hormones, we do use these hormones, growth hormone, testosterones, different types of testosterones, injectables, orals, local, topical, and for growth hormone injectables, of course. We do use that, but in medical fields, we use very
Low doses.
exactly, very low dose, very minute doses in comparison to the dosage that these
Given in the
gentlemen are
gym.
exactly.
Yeah.
So the side effect profile of these medications are quite serious sometimes. For example, increasing red blood cells, causing the blood to be thick, if I wanted to describe in layman's terms, and prostate hypertrophy enlargement, as well as some other issues like aggression. The people who might be using lots of huge doses of testosterone might develop aggressive behavior.
So the side effects might be as well as psychological, not
Of
only
course.
physical ones.
And in the off season, let's say when they are not using, the person, I mean, can go into pathologic depression, as well as sexual dysfunction. And he's a young gentleman, he might be married he might have some social, psychological issues related to that. So definitely they should be using, if they wanted to use these medications, at least seek medical advice from a specialist. In general, I do not encourage taking,
Especially without the
of
medical
course, yeah. In general,
supervision.
it's not advised.
But
Yeah,
let's
go ahead.
having from the positive point of view. What is the effect of these androgens or drugs
Yeah.
on the body?
We have certain population, actually two types of population. First of all, the first type is the patients who are deficient. They have a problem. They have lack of secretion of testosterone or growth hormone. We give them replacement, the physiologic doses, where they should not have any side effects of that, because it's only minute doses, minimal doses, and replaces the normal physiology. This is one type of patients. The second type of patients this is generally coming somewhat to the surface now, like a trend, where they use something called TRT, testosterone replacement therapy. This is usually, the patient is usually above 45, let's say, above 50 usually, where he complains of lack of energy, lack of focus, concentration. True, genuine. And when you do the blood test, you find his testosterone on the lower level, almost normal or just below normal. There are some studies to suggest that they can use also this small dose replacement, not the mega doses that our friends are using. So even these patients who are, let's say, above 50 and they are using replacement small doses of testosterone, they do feel much better. They have more energy, lots of issues improve, as well as their muscle mass improve, concentration improve. But we do follow closely the side effects, prostate, etc., the ones that we mentioned. So it has benefits definitely. And the side effect profile in younger age group is quite, you can't ignore it. You can't ignore it really.
So now, let's say potentially, if the person is using them since a young age,
Yeah.
and normally they start with the 18 to the 19 years old
Yes.
when they start having their own cars and then go to the gyms.
Yes.
You have said that some trainers, they may have the good experiment or
Yeah.
the good expert. They are good expertise in this field. If they recommend it, sometimes they even give more advices than a medical professional.
Yeah.
To what extent you believe that these trainers would give a good advice to these users?
Yeah. First of all, as any teacher
Mhm.
in the world, anywhere you go to learn new information, you have to choose your teacher. That's first of all. So do choose wisely, my friends, my brothers. Do choose wisely. Not every trainer is a trainer. First of all. Secondly, when I say that I respect their knowledge, their experience, I found it. I saw it. For example, the person comes to them. He did use potent steroid testosterone regimen. Then I see what he has advised him to take to reverse the action. For example, when a person takes large dose of testosterone, his normal testosterone, the one secreted in his body, is almost zero because he's depending on external testosterone. So when he stops, this normal testosterone is very low. And I can tell that this trainer is experienced from what he prescribed to this gentleman. For example, you should take this and that, this to enhance your normal production.
Yes.
This is science. So they some of them, they really are quite scientists.
I think they have been in the field like for more than 20 years, but
Yes,
not
yes,
everybody in the gym
yes.
is an expert.
Of course.
As you
Of course.
said, you have to choose your teacher. But the question is, these medicines, are they being used by women as well?
Generally in
Away
Kuwait,
from the medical use.
yeah,
Let's say about the performance enhancement.
definitely.
Yeah.
Yeah. In Kuwait, there is a population of our sisters, ladies. They are using enhancement performance or performance enhancement, sorry. And it is quite not a big number, to be honest, not like the guys, yani. And they develop the same side effect profile.
No, the question is because these normally are male hormones.
Yeah.
So some people might think that these hormones cannot be used even medically in the woman. Is that right?
Very rarely medical conditions that require male hormone replacement in women, certain ovarian cancers, for example. But if the lady is using male hormones just for exercise wise, it is being done. It is not a big number, little number of persons, of ladies, and they do develop side effects. The first important side effect is they have disturbed menses, the monthly cycle, menstruation.
Hirsutism as well.
Hirsutism, definitely. They complain of hair loss and like a male pattern type of baldness. So they do develop the muscular type, they do develop the muscles, they do develop the energy because of using testosterone, fine, but also they develop serious side effects.
Okay,
Yeah.
one more final question regarding the use of growth hormones. Can the ladies use it as well?
Yeah, growth
I think which
hormone.
is different from the testosterone. It's
Yes, of
it's not a
course.
male hormone.
Yes.
Yeah.
Growth hormone is found in men and women, of course, and it is used in early adolescent life to induce bone growth as well as reaching the intended height, genetically intended height. Then growth hormone usually has no much effect in human physiology, at least that we know about. But it does regulate blood glucose. It plays a role in regulating blood glucose. That's one. Secondly, it has an effect on collagen, on skin, on nails, let's say, soft tissue or connective tissue. It has an effect. That's normal function of growth hormone. Medically, we use a growth hormone usually in patients with whom have young children,
Yeah.
or young adolescent, young men, young women, who have they are not growing properly to their expected height.
With a height chart or the weight chart.
Exactly.
Yeah.
So short stature basically, and we do give them, after certain labs, challenge tests, then we give them growth hormone. But bodybuilders, men or women, using growth hormone, they usually use it to
Increase the muscle
no,
mass.
to actually to reduce the fat,
Mm.
to reduce the fat subcutaneously under the skin.
Mhm.
The growth hormone has an effect in that, reducing to be shredded, let's say, shredded. So not every person benefits from growth hormone. You have to have a genetic potential. Not every
So it's not for general use, as you say.
no, and it's not that powerful. It basically reduces the amount of fat under the skin, so the muscle shows nicely.
Yeah.
It does not increase size of muscle, does not give you power at all. Some people, they talk about healing, faster healing, and collagen, tendon healing. Nothing is documented in that point of view.
Well, that's a very good point of view, because some people think that the use of growth hormone may give them bigger muscles as well.
Yeah.
As well as you say that it can be used for growing nails and hair, but that doesn't mean our sisters or ladies
Yeah,
take
course,
this
yeah.
medication for growing up their nails.
Of course.
Dr. Muhammad, we have reached to the end of our segment, and we are so pleased to have you today.
Thank you very
Hopefully we
much.
can have you again.
Thank you very much.
Thank you
Thanks
very
a lot.
much. Our dear viewers, we have reached to the end of our segments. Please have us again in the next segment with a new doctor and new professional. See you next time. Goodbye.